for March 18th, 2021. My name is Brian Wheeler from Mono County Public Health. And again, tonight I'm joined by officials from the county and the town of Mammoth Lakes. And we actually have a few new panelists as well that we will introduce. But before we get into our question and answer, as always, we'll have Stu with our updated slideshow. Stu?
Great, thank you, Brian. Good welcome, global audience. I'm not too sure how many presentations we've made, but I just want to thank everyone for joining us on these Thursdays to keep up to date, to stay informed of our progress, our challenges, and how we've been managing coronavirus. So let us jump into the presentation. Just want to again welcome our Spanish speakers this evening, and I do want to introduce our new public health Latino outreach coordinators. We have Maria Vega and Juan Rios with us this evening.
Hi, everybody. My name is Maria. I am one of the Spanish speakers for public health, and I am more than happy to be here and to assist in any future projects.
Hi, everyone. My name is Juan Rios, and I'm the second Latino outreach specialist that was hired for Mono County Health Department and for the people who speak Spanish. Yo me llamo Juan y estoy aquí para ayudarles en todo lo que necesiten con relación al condado de Mono y con relación al centro de salud. Si tienen cualquier pregunta, por favor, busquen mi número de teléfono, mi nombre con el centro de salud, háblenos y yo les puedo dirigir para sus vacunas y para las clínicas. Muchas gracias y espero ayudarles. Thank you.
Great, thank you, Maria. Thank you, Juan, and welcome to the team. And I'm sure the community looks forward to meeting with you over the next coming days and weeks and months ahead. Mountain View Fire resources available on the Mountain View Fire resource portal. You can see there the URL right in the middle of your screen. And the team does an outstanding job of keeping that updated along with the Mountain View Fire Resources and Recovery Facebook page. So please utilize those resources for anything related to the Mountain View Fire. Stay safe to stay open. Clearly more than a hashtag, as we've been learning over these last months, needs to become a way of life for us in Mono County. Now more than ever, we really have to stay safe to stay open. That means keep doing the basics. Keep your 6 feet of distance, washing, sanitizing your hands. And as we know, those face masks do work. So we want to remind everybody to keep wearing your face masks indoors, in public settings, kind of outside your household units. Certainly there's some vaccination guidance that we've kind of been through in the last few community conversations. But again, the basics are so important to keep us open. Get vaccinated when it's your turn. Again, just want to remind everybody to pre-register. Even if you think you're not eligible, please get registered so we know that you are interested in getting vaccinated and we can schedule an appropriate clinic for you. And again, stay informed, and you can do that by joining us every second Thursday on our community conversations. You can also subscribe to receive our COVID newsletter, and that's emailed to your inbox every Tuesday and Friday. So definitely subscribe to receive that. And then again, any questions you may have, COVID-19 help at mono.ca.gov. So again, I just want to encourage everybody to stay informed, be civil, we're all in this together, and to respect each other. Let's just jump into the case stats. We're just going to look at this one here. This just kind of shows you the trend as we present every presentation. All this information and more is on the case stats page on the portal. You can see here a 30-day increase of 29 or just 3%. So definitely a great 30-day, look back. But we are seeing an upward trend in cases. Looking at our case stats right now, there's been 8 cases in 4 days. So we want to remind everybody, like we mentioned, keep doing those basics, right? We've got to keep these case rates down if we want to move through the tiers. So again, let's just keep doing the basics and keep those rates down. We talked last week on March 4th, a couple of weeks ago, about the vaccine equity metric. Hopefully we didn't confuse everybody. but we achieved that vaccine equity metric goal of 2 million doses. And we achieved that just under probably 10 days ago. And that enabled us to get from purple to red. The next goal that we're after is the 4 million doses. So if the state administers 4 million doses to the same, what's called the Healthy Places Index Quartile 1, which is the bottom left-hand side of your screen there. As soon as they get the 4 million doses, and that's just doses, it's not, fully vaccinated. As soon as they reach that metric and that threshold, you can see down here on the bottom of that table, they shift the orange and the yellow tier thresholds. So much like they did with the red tier, the orange will shift from 1 to 3.9 to 2 to 5.9, and then yellow goes up from less than 1 to less than 2. Now, it doesn't seem like a lot, but it makes a big difference. So for us, if we want to move into that orange tier, we have to keep those case rates down. So looking at our metrics based on March 6, remember the state is, 7 days behind, kind of has that 7-day lag. Our current case rate, and this was as of Tuesday, it's reported every Tuesday on the CDBH website. We had a case rate of 6.1, and you can see the statewide average was 6.5. And, I just wanted to kind of put that, that note in there on trends, right? So we are seeing an increasing case rate. 8 in the last 4 days is a lot. Clearly, that would put us over this orange threshold. So, we can only have a maximum of 5 cases each week for 2 consecutive weeks. And that will allow us to get to orange. Testing positivity rate is still good. We're still under kind of that new threshold of 4.9%, so 3.8 is good. So what it really means is under the new guidelines, we need to meet both of those metrics for 2 consecutive weeks to move to the orange tier. But that depends on when those 4 million doses have been achieved by the state. So I just want to make sure that's clear for everybody right now. So those thresholds don't change until the vaccine equity metric goal has been reached. Happy to answer any questions on the Q&A if anybody has those as we get through the presentation. We also had some questions about moving kind of through the tiers. So we've kind of added this slide here. This was introduced last October, if anybody remembers. And this was kind of moving up into less restrictive tiers. And what happens when we, see those case rates and we're required to move to kind of those more restrictive tiers? So the state introduced what's called the small county framework. And what that means is for counties with populations, or those areas with populations under 106,000, and in our case, I've circled the population under 35,000, which is kind of where we are. So that means that in our red tier, we can have up to 35 cases each week for 2 consecutive weeks before we be required to move to the purple tier. If we get to the orange tier, we can have a maximum of 14 cases for 2 consecutive weeks before we'd be required to move to the red tier. And when, I'm going to say when we get to that yellow tier, we can have up to 7 cases for 2 consecutive weeks before we'd be required to move to the orange tier to move back again. So anyway, so just want to make sure everybody's aware that right now this is in effect. So, while we're in this tier, things are doing great. But again, we're going to keep those case rates down. Just a quick summary of Mono County red tier business sector operations. Just wanted to bring everybody's attention to the latest guidance that was introduced on March 13th. And that's related to wineries, breweries, and distilleries. So those businesses can only operate outdoors, and you can kind of see the bullet list there as well, reservations, 90-minute. And limited hours of service, consumption closed by 8 p.m. And then bars as well, no real change there. If a meal is provided, those bars can operate with restaurant modifications. And as we know, restaurants can operate maximum of 25% capacity or 100 people, whichever is fewer. And again, everybody is familiar that the town rescinded its short-term rental lodging order on March 11th. All that information and more is on this Blueprint for a Safer Economy website. So again, just covid19.ca.gov, type in Mono for the county, and then just type in whatever business or activity sector in that tab on the right there, and that'll show you kind of what those modifications or restrictions are. Just a quick school update. Mammoth Elementary School opened March 1st for TK through 2. Grades 3 to 5 opened on March 8th. And then middle school and high school is scheduled to open on March 22nd. If you have any of those, any questions related to school operations, please direct those to the Mammoth Unified School District. I know there's been a few things going on. I'm not too sure the panel here this evening would have all or the latest information to pass on to you this evening. But again, that's just a quick school update. I did want to bring everybody's attention to the recent updates to outdoor and indoor youth and recreational adult sport guidance. You can kind of find this information on kind of what they're calling this youth sports Q&A. It also includes adults there as well. But it really just kind of walks you through what kind of sports activities are allowed in each tier. So if looking to operate a youth sports group, ask those questions to Parks and Recreation Department, go to this website, try and look for this information. They have all the guidance relative to how you can safely participate in those sports. But you can see here, outdoor low contact, up into the red tier, they add these other, what they call outdoor moderate contact sports. And then you're moving into the outdoor high contact sports in the orange tier. And then that orange tier also allows kind of these indoor low contact sports. You can see they're on that list. And then in the yellow tier, you're going to have indoor moderate and then indoor high contact sports. So again, just kind of walks you through those sports and activities in the different tiers. So good news moving forward. And we want to get indoors and certainly start to work out, be safe, and be active and stay healthy. Mono County COVID-19 vaccine dashboard team has been doing exceptionally well. Just under 14,000 doses received in Mono County, which is great. Just under 7,000 first doses. And you can see almost 5,000 fully vaccinated Mono County residents. So great news there. Again, stay informed. Visit our Vaccinate Mono website. Get all this information and more. Mono County, we've sadly slipped to second. I know, Brian, you probably got to pick up the pace a little bit more, but this is probably just due to a little bit of a data lag with the state in the reporting. But we've been pipped by Alpine County. That was as of today. But the state's doing remarkably well. You can see the statistics. You can see they've administered 13. One says 1303. The other one says 13.3. So anyway, let's go with the bigger number, 13.3 million. 231,000 doses a day, which is a great number. And 4.5 million Californians have been fully vaccinated. So a lot of good information. Again, this information is on the CDBH website.
And Stu, I just want to remind our listeners that only 1,000 people live in Alpine.
We missed that, Brian. What was that again?
I said I just wanted to remind our viewers that only 1,000 people live in Alpine County.
Yeah, I know. Anyway, we'll get there. We'll take that top spot back again. No worries. Thanks, Brian. Vaccinate Mono questionnaire. So, this is still live. We've updated this form. If you haven't pre-registered, please do. We are really working through our lists. We really want to make sure we can get you vaccinated if you want to be vaccinated. So please complete this form. It's in English and Spanish. We've made it even easier. It doesn't include any of the tier information at all. So it shouldn't take you, but a couple of minutes to complete. And then the last question we'll just ask you is, what is your primary residence of record? The IRS has some specific definitions there. So we just want to make sure we're primarily, right for now, vaccinating our residents. At this time, we're not vaccinating our second homeowners. just because vaccine is allocated per county based on our population. So again, please pre-register on our questionnaire. Please bring your proof of eligibility to your next vaccination clinic. You can see here anything: driver's license, real ID, change of address, employment pay stub, employee ID, and we can vaccinate those folks that live or work in Mono County. So if you live in another county but you work in Mono County, just bring their employment pay stub or an employee ID. These are the top 3 questions that we've had over the last kind of week or two. You can kind of read here: what if I can't make it to my appointment for the second shot? You still need to get that second shot because you're not fully vaccinated until you're not fully protected until you do. And then you can kind of read some information here. Until you're fully vaccinated, you need to continue to wear that mask, stay 6 feet apart, 2 arms lengths for instance. If you are fully vaccinated, then clearly you can start to engage with family indoors without a mask, which is great. We kind of walked through those guidelines last time. I've had my second shot now. What? You can see here, you can provide some guidance there as well. You can gather indoors, as we said, without wearing a mask. But again, in public, keep taking the precautions as we've kind of listed above there for right now. And then why am I not fully vaccinated until 2 weeks after the second shot? And the answer there is it typically takes 2 weeks for the body to complete building protection against the virus. A person could still get COVID-19 before or just after a vaccination and then get sick because the vaccine did not have enough time to provide protection. So again, just those top 3 questions that we get. This information is on the CDC website and also on the FAQ page of the COVID-19 portal. I've just added this slide here, bit of myth busting. We get these questions, you can kind of comb through a lot of the information that we're seeing on the news or on websites and so forth. But these were the kind of the most relevant ones that I thought would be good for our presentation this week. You can see here, over 109 million doses of vaccine have been administered from December through March. So a big number. During this time, the Vaccine Adverse Event Reporting System, that's that acronym there, have reported just under 2,000 deaths among those people who have received a COVID-19 vaccine. But a review of the available clinical information revealed that there is no evidence that the vaccine contributed to that patient's death, so they're very safe. And you can see here, based on how these vaccines work, experts believe they are unlikely to pose a specific risk for people who are pregnant. And then on March 17th, World Health Organization continued to approve the use of the AstraZeneca vaccine. And then the public health officers, and these were just from 9 Bay Area counties, you can see there, issued a statement Monday emphasizing the fact that all of the vaccine options are safe and have been shown to be highly effective at preventing symptomatic illness and hospitalization. And then an official from the CDPH stated that the best vaccine is the first one that's in your arm. So as we've talked about, we get infections down, we're going to get back to normal as close as we can. So anyway, just some myths that we've got out there. Just wanted to make sure we're reporting the facts to you. And I'm sure we have any doctors on this evening, or Brian can add any additional information regarding these bullets this evening. COVID-19 testing. OptumServe is now testing. You can see there Tuesday, Wednesday, Friday, and Saturday in Mammoth Lakes at the Mammoth Lakes Foundation. That's from 11 a.m. to 7 p.m. And then Public Health is also providing testing throughout unincorporated Mono County, and that's every Wednesday and Friday between 1 p.m. and 4 p.m. And we post the updated schedule on the COVID-19 portal under the Health tab. I think Wednesday it's in Walker, I think next week. And I think Friday is in Benton, but look for that information on that website. Our next scheduled bilingual community conversation is Thursday, April 1st at 5:30. And then again, all this information and more, we've seen this slide, is found on our website in English and Spanish, COVID help email. And again, if you haven't subscribed, please do. We'll get all this information out on the COVID newsletter every Tuesday and Friday. And I think, Brian, that is it for this week. Thank you.
All right, thank you, Stu. There's one local myth I would like to bust as well. There's a rumor that the vaccine costs $300 to get, and that is not true. The vaccine is 100% free, no charge whatsoever. So just want to make sure that we get that out there. All right, so why don't we go to our first question of the evening?
We don't currently have any questions. We did have one question that Dr. Boo answered already. Would you like me to read that aloud?
Sure, why not?
Okay. Why does Mono County show about 2,500 more vaccinations administered than the number shown on the state CDPH website? And do you think other California counties have administered substantially more vaccinations than reported by CDPH, which is the source for the LA Times and New York Times vaccination maps?
And what was Dr. Boo's response?
Sure, Dr. Boo, I'll read it for you. Yes, a few days ago, I emailed a couple people at the state about the data lag, haven't heard back. So I have generalized doubts about the currency of the data on the state website. Probably not helpful at this point to compare counties using this data.
See, Stu, we really could still be number one. All right, do we have any more questions?
We do. We have 2 children, 3 and 1, and are considering having a babysitter help out a few days a week. We desperately need childcare. The babysitter and my husband are fully vaccinated. I have had my first shot. Should we still all mask up? What is the risk for the kids?
Dr. Boo, can you field that for us?
Yeah, sure. I guess I want to know a little bit more about the questioner's exposure. The questioner is partially vaccinated, but if the babysitter and the husband are both fully vaccinated, again, that's defined as Stu just said, as 14 days after the receipt of the second dose, if it's the 2-dose vaccine, or 2 weeks after a single Janssen or J&J Johnson & Johnson vaccine, then no, I don't think that masks are necessary.
All right, thank you very much, Dr. Boo. Can we go to our next question?
Sorry, she clarified for you, Dr. Boo. I stay home, husband works, but is exceptionally careful. They are both 2+ weeks after vaccination.
Yeah. So I think the situation described is fine and low risk, and masks are not necessary around the kids.
Thank you, Dr. Boo. Go ahead with our next question.
We currently do not have any questions.
All right. Would anyone like to give any department updates, perhaps?
Just a quick follow-up, Brian, I think on that vaccine question about is there any administration costs? And that was a no as well, right? So the whole process is exactly free.
Free, just bring yourself and some ID.
No strings attached, except IDs.
And I do not know about Rite Aid, for people who might not be aware. Rite Aid does have some Janssen or Johnson & Johnson vaccine. They're limited in terms of the number of people that they can vaccinate on a daily basis. But I don't know if there's any administration fee there or not. But the vaccine itself is free from the federal government.
And Vaughn's also now has a vaccine as well. And their appointments are being set up through their website. I'm not sure what vaccine they are using.
That's great. That's the first I heard. Hot off the press.
Hot off the press. Just talked to Cal tonight.
Tonight only.
Excellent.
The scoop.
Brian, just to clarify though, if you do have insurance, you should provide that information. Does it can bill to your insurance?
Some of the registrations for like My Turn, they do ask for that information. you can provide it, but if you don't provide it, it does not affect your ability to get the vaccine. So I don't know if they actually can bill, or they're just thinking that in the future they might be able to. Tom, do you have any insight on that?
No, I really don't. I mean, and that's kind of the same case for testing, right? I mean, when you register for OptumServe, and by the way, for anyone who's interested, I think the testing turnaround times and the experience with testing with OptumServe this week, it's pretty impressive. I mean, basically next day results now. But yeah, when you register, you're asked to provide health insurance information. If you don't have it, it doesn't matter. But certainly Mono County, we don't have the infrastructure, the time, or the people to be trying to bill insurances or individuals. If the state is seeking to bill insurance companies, I don't think it's happening yet for vaccination. But.
Thank you, Dr. Boo. I believe, Rob, you wanted to give an update?
So that medication that we discussed, that one that you.
No, I didn't, but I'll go ahead and get one.
Okay.
The town, as we've kind of gone into the red tier and started opening some of the restaurants, I know, we've been out and about looking over that process. I've been supporting them in their reopening process. And we're just happy to have that functioning. It's an incredibly critical part of our business structure within town. So it's going to encourage folks to get out and experience what it's like to go to a restaurant. It's kind of nice. So
I understand you've been stepping out a little bit.
I have. I've tried to hit one every day.
All right.
Along with the gym, obviously, because can't eat out every day.
And not go to the gym.
I'll jump in after Rob just to talk about town offices. So good news again. So while we're in the red tier, Town of Mammoth Lakes offices are going to open to the public on Monday. So again, anybody that wants to come in, you can see staff at the front counter. We're located in the volunteer regular hours from 8 a.m. to noon, and then from 1 to 5 p.m. Monday through Friday. So again, our town offices at the front counter will open on Monday. And I know everybody's looking forward to actually talking to some of our community members in person. So thank you, Brian.
Certainly. Thank you, Rob. Chief Davis, I see you turned your camera on. Was there something you wanted to discuss? You're on mute.
Probably more clarification about the Rite Aid and CVS. Can you just sign up and get it, or do you have to, like the tier system that we had to go through from the public side? Is it just sign up and get it through your insurance or whatever?
I think it is, but I'm not totally sure. They do not fall under the jurisdiction of the health department, so we really have little control over what they actually do.
So yeah, makes sense.
Sorry.
Go ahead, Tom.
I was going to say my guess is that they're following the state eligibility requirements. So at that point, at this point, it would be people in essential work sectors, and then most recently people under 65 with certain healthcare conditions, medical conditions, that kind of thing. So that'd be my guess. We're a little bit ahead of that. In the county, we're vaccinating basically anybody now, but probably the pharmacies are feeling obligated to follow the state eligibility. But that's a guess.
Thank you, Tom, and thank you, Chief Davis. Do we have? I see we have another question that came in.
Yes. I am still confused about the numbers and how the tiers work. What is the magic number specifically for our county? Stuart showed the tiers and the number, but there was a comment about only 5 per week and another about 14 per week. 35 for 2 weeks moves us up, but then what about the 10 per 100K? So confusing.
It is confusing.
It's clear as mud.
I could take a shot. I mean, basically there's different numbers, different thresholds for moving from a more restrictive to a less restrictive tier. You've got to achieve lower numbers. Like currently, If we were in purple, we would have to be under 10 cases per 100,000 people per day, which is about, in Mono County, it's about 10 cases in a week. But once we're in red, even if we get more than 10 cases, as long as we stay under 35, we're okay. So the state gives small counties more leeway, more latitude to stay where they are and not, continually and disruptively, being moved to more restrictive tiers. So it's harder to move to a less restrictive tier, but it's somewhat easier to stay in that tier and not go to a more restrictive tier, if I'm making sense.
Here's a cup of coffee.
Yeah, so I think the takeaway there, where the number 5 came in, is for us to move into the orange tier.
Right.
When we get to the vaccine equinometric goal of the 4 million doses, we have to be no more than 5 cases, for those each week for 2 consecutive weeks to move to the orange tier. So I think that's the reference to 5. So no more than 5 cases each week for 2 weeks to move forward. And then, as Dr. Boo said, we've got some latitude there, and we've got up to 35 cases. And I'll just pop this slide up. That would force us to move back. So certainly, more restrictive and harder to move forward. And we've got a little bit of a leeway for our small counties to get moved back. So Brian, I don't know if you wanted to jump in there too.
It's honestly very, very confusing. We all have to kind of keep scratching our head and thinking, how was it again? And then they change it. And Stu is amazing at keeping track of it. Yeah.
I'll leave it with what you guys presented. That was perfect.
We'll try. And again, any questions, please email us. Happy to, jump on the phone. And I know Justin can kind of jump in on this COVID-19 help@mono.ca.gov email address. So please don't hesitate to reach out. Yeah, thank you.
Hey, I thought it might be worth sharing some relatively new and good news type information that was shared by the CDC earlier this week. There's been big question. It's a really important issue about whether vaccinated people can still get asymptomatic infection and transmit. The studies that led to the approval of these vaccines, they were only looking at people who got sick, who had symptoms. They weren't testing for people who might have silent infections. But there's data out of Israel, which has the highest vaccination rate, on the planet so far, that the mRNA vaccines, the Pfizer and Moderna vaccines, are both roughly around 90% effective at preventing asymptomatic infection. So it's a preventive, effectiveness rate pretty comparable to their effectiveness in preventing us from getting sick. And it also appears that when people have been vaccinated but do get infected, that the amount of virus, in our airway, nose, throat, trachea, lungs, whatever, is substantially lower than unvaccinated people. So therefore, it's quite possible, but not yet known. But people are vaccinated but get infected might not be very infectious to others. So it's preliminary data. We're going to continue to learn more, but it's very encouraging to me. I think it's great news. So
that is good news, Dr. Boo. Thank you for sharing that with us. I do see we have a couple.
Hey, Brian.
Oh, go ahead, Ingrid.
Oh no, my own anecdotal story from what Dr. Boo was just saying is I was likely exposed between my first and second vaccine to someone who was positive but asymptomatic, and I have tested positive 3 or 4 times. I mean, tested negative 3 or 4 times since then. So even just the first dose of the vaccine helps, but the second dose for sure. So it does work. I can tell you from experience that I was most certainly exposed to someone who was positive with coronavirus, and I am completely without the virus, negative. So it does work.
That is fantastic news. Thank you for sharing that with us, Ingrid. Greatly appreciated. All right, I see we have a couple questions in the queue, so why don't we go to the next one?
Do you have some idea or feeling of how many people in Mono County will not be getting vaccinated due to personal choice?
Ooh, that's a tough question. Dr. Boo?
Yeah, I mean, tough question. We don't know. I mean, we just look at the, the latest national surveys, and I think it's running, around 30%, higher in people who identify as Republican and Republican males. And I don't know. We hope that almost everybody in Mono County will ultimately choose to be vaccinated. I mean, I worry about a situation where people who are vaccinated are protected and staying out of the hospital, but we still have people getting severely ill or dying who are not vaccinated. So and it's normal to have questions and concerns, and it's a new product, and there was a lot of uncertainty last year, concerned that the studies, the approval process were being rushed, but the data is just overwhelmingly excellent. I mean, there's, I don't know what, close to 100 million, somewhere around 100 million people in this country have been vaccinated so far, and it's very safe, and it's very effective. These are much better vaccines than I could have dreamed of 4 to 5 months ago. So when we were vaccinating up in Bridgeport a couple of weeks ago, talked to a teacher who had come down from Antelope Valley, Colville, and she had been not ready to get vaccinated when she first had an opportunity, some weeks before, and she said there was a handful of other people, teachers and school staff, in a similar situation, who didn't want to be the first, but having seen that their friends and coworkers were doing fine, they were ready, and that's normal, that's natural, and hope to see more of that. That some people just need more time and observation and experience and reading before they're ready.
Thank you, Dr. Boo. And why don't we go ahead to the next question?
Are all law enforcement vaccinated? Should I happen to take a ride with them?
Al, if they should be so unlucky as to have to take a ride with you or Ingrid, how does that look?
That's a solid hell no. No, our employees, and Al can answer if his employees are differently, they come from the human race and they have their own qualms and fears. And I would say probably most of my deputies chose not to get the vaccine. That was their own personal choice. And in a perfect world, could I have mandated it? Yes, but that's not how we operate. They have free will just like everybody else. So no, but they should be wearing masks. And if they're not, you can request that they do while they're interacting with you, especially once you're in a car ride. Sometimes in tactical situations, there isn't time to put on a mask as you're running into a situation. But if they're driving you northbound to my bed and breakfast, then they should have time to put on a mask.
And very much agreed from my standpoint with my officers and staff. It's a personal choice whether they decide they want to do it or not. And some, like Dr. Boo was saying, want to wait to see long-term just to make sure there's nothing wrong with it, or waiting for the single shot. So there's a variety of different things, but yes, social distancing, masking, et cetera. And I absolutely want to agreed with the sheriff that tactical situations or fights or things like that, masks are like last on our list of things to worry about at that point. So but
if you're getting a ride to, sorry, go ahead, Al.
Yeah, if no, I just lost my train of thought. Go ahead, I'll remember, Sheriff.
If you are getting a ride to my bed and breakfast, which is lovely, it's free, but not in the long run. It's free for that night. You will get a free ride to the hospital first, and you will get tested to make sure that you are COVID free, because we do not want to introduce COVID into the jail. So there is a testing process. So if you have committed a crime that merits you going to Bridgeport, you will get a free COVID test lucky you. So
Yeah.
it's probably not the best way to get testing. There's other free testing you can do. So, you know, getting arrested is probably not your best route, but you will be assured that you are free to be booked.
Sheriff, that's also a way to get a vaccine as well, because public health
true,
will
yeah.
definitely be vaccinating and has vaccinated inmates.
Right. I probably had more inmates than deputies vaccinated. But to that point, to Al's point, we have had deputies subsequent to when the first round was offered, where they said, "No, I'm not ready. I don't know if that's for me." Have changed their minds and have had come around and had the vaccine. So as we progress through this, like we will through all of society, people are becoming more and more convinced that the science is working.
Yeah, and I'll add that I definitely have recommended and changed the minds of a couple of my employees, and you know, we're supportive of it, and just want to get, you know, everyone vaccinated. Gets us down the road much quicker to future normalcy.
Thank you, Sheriff, and thank you, Chief. Why don't we go to our next question?
Are students being tested at the schools?
Dr. Boo?
Yeah, I don't think so currently. I think tomorrow they're starting testing of teachers, you know, at Mammoth Unified. The elementary school is what's open. And been in some discussions with Colleen, the school nurse, about use of rapid tests, you know, in the school on an as needed basis. But I would certainly encourage families, parents to, you know, kids who are in school to get their kids tested. And again, I'll put out a, you know, a plug for OptumServe. You know, before we had Project Baseline Verily, and initially they couldn't, they didn't feel comfortable testing any people under 18. They did, you know, before their contract ended, they were testing people, I think, above 13 or something like that. But OptumServe will test people of any age, and it's a, you know, it's a really simple self-administered swab. I mean, if it's a little kid, you know, probably the parent or a nurse would do it for them. Although pretty young kids can do it, but you know, you're just putting it a little ways in your nose and rolling it around. And so, you know, the teachers are going to be tested on a regular basis, and I would encourage parents to do some family testing too.
Mm-hmm.
All right, thank you, Dr. Boo, and thank you, Stu, for getting that slide up there. Do we have any more questions?
Not at this time, Brian.
All right.
Brian, I have a question for you, or
Sure.
maybe Dr. Boo. Moving into the orange tier, I know it's 2 weeks at a certain metric. Is it 2 weeks from the revised date, since we appealed to the state and they revised when we were supposed to go to red, or is it 2 dates from the date that we went into red on that Friday or Saturday or whatever it was?
Yeah, Sheriff, a health officer asked that question on a statewide call yesterday, and I didn't think that the response it wasn't completely clear to me, but and again, you know, you have to be 3 weeks, you know, in a given tier with 2 weeks of you know, good numbers, you know, below the threshold to move. But I think they look at the previous 2 weeks from whenever you you know, meet the threshold. You know, so I mean, we moved this time on a Sunday instead of a Wednesday, which would be the normal day for movement. And I think we would be eligible to move again on a Sunday 3 weeks hence if we met the tier, but I'm not 100% sure on that. Did I answer that? Was that your question? I mean,
Yeah, it is my question, and it's government, so I can't expect a clear answer. So you did the best you could.
All right, thank you, Dr. Boo, and thank you, Sheriff Braun. Any other questions? Any other reports that anyone would like to give?
you know, I could talk just a little bit about the West Coast variants. I think just within the last 24 or 48 hours, these variants that were found in Mono County, among a lot of other places, in California, first identified in California. I guess originally, I read first identified in California, but actually it was first identified in Wuhan, China, I think, in May of last year. But outside of Wuhan, California is the first place that what they're calling B1427 and B1429 have been identified, and they are definitely increasing. But what I was going to say is that CDC just upgraded them from variants of interest to variants of concern. There as yet are no, the third category, the highest risk category that CDC is now using. It's a new category, but it's called variants of high consequence or something like that. And so, but anyway, the West Coast variants, which are increasingly common now, probably at least half, maybe the majority of infections in California are now considered variants of concern, whereas before they were just of interest. Nobody really knew what the significance was, and that's based on the fact that they have been shown to be more transmissible.
Tom, did we lose you?
I don't know. Can you hear me?
Yes.
Okay. Yeah. So anyway, the West Coast variants have now been shown to be more transmissible than the original COVID virus, but not as transmissible as the UK variant. So one study I believe showed that in households it was about 10% more infectious. People were 10% more likely to be infected if somebody had a case in their house compared to the original wild type virus. They call it the wild type. But other studies have shown that it's 20%. So somewhere 10 to 20% more transmissible, and some of the therapeutics don't seem to work as well against it. I mean, things that aren't that widely used, certainly in Mono County anyway. But like Bamlam, yeah, I can't pronounce it tonight. I practiced when it first came out and I had it down. But anyway, but some of the IV antibody therapies that can be given to people in hospital settings when they have mild to moderate disease and are at risk of severe disease don't appear to be as effective against them. So I don't know. We're just learning more about the variants, but the West Coast variants are moderately more infectious than what we've been dealing with up to this point. So.
Thank you, Dr. Boo. That is good information. Anybody else? Any other questions from our followers?
No questions at this time, Brian.
All right. Well, then we will adjourn early. So, Mono County, until we see each other again, take care of yourselves and each other. Have a good night.
Bye, everybody.
Thanks, everyone.